Okay, Karen, you're live.
Good morning. I'd like to welcome everybody to this week's community update. It's December 22nd, 2020, and there's lots to talk about today. In addition to the Medical Officer of Health, Dr. Hsiu-Li Wang, and Deputy Chief Shirley Hilton, we will have Grand River Hospital President Gagnon join us for today's update. Thank you all for being here. Today, we're launching the In This Together campaign with the regional municipalities and public sector organizations. It's been a tough year to say the least, and the goal of this campaign is to bring our region together to help support and protect each other as we patiently wait for the vaccine to be distributed. And as we limit the contact to our household only, it's important to continue to be kind to yourself and each other. You're welcome to show your support by displaying one of our signs like this in your window, or you can post on social media using hashtag BeKindWR. Images are available in 10 different languages on the region's website. In lieu of an enforcement update, I would like to say that the region and its enforcement partners, the Waterloo Regional Police Service, municipal bylaw and public health inspectors, will continue to educate and enforce bylaws. This includes fines where necessary for as long as necessary to keep people safe. Over the holidays, throughout the province-wide shutdown and beyond, until public health measures are no longer in place. The province has announced a shutdown starting midnight December 26th, and Dr. Wang will update us on the measures for Waterloo Region as well as provide a public health update. Over to you, Dr. Wang.
Yes, thank you, Chair Redman. So in terms of overall trends, we continue to see high numbers of new cases every day, with outbreaks in workplaces and congregate care settings being declared daily, and continual hospitalizations, ICU admissions, and sadly, deaths. This is not unlike the situation in several medium to large areas of Southern Ontario. I'd like to just show a graph that was presented by the provincial modeling experts yesterday. So I'm just going to move my thing so we can see there. I am just going to, sorry, I just realized I am to show my notes at the same time. But okay, I'll just go back to the picture. So you can see that there are several areas in Southern Ontario that are over the 40 per 100,000 per week case rate. And these numbers are from a few days ago. So I actually have the latest for Waterloo Region, which I'll talk about now. So our incidence rate has started to climb again. It is now at 96 cases per 100,000 per week, the highest it has been to date. It is starting to approach those areas which have already entered lockdown. 5 areas in Ontario have already entered lockdown. Our incidence rate is currently 7th highest in Ontario. This fluctuates. Recently, we have fluctuated in the range between 6th and 10th in Ontario. Our current percent positivity, taking into account interim data, has increased to 3.9%, which is high. Our reproductive rate is currently at currently at 1.1, which means that we are projected to continue to grow. Therefore, there is widespread transmission of COVID-19 in Waterloo Region, and it has started spreading faster again. We need to act now. We are headed in the wrong direction. and we cannot wait until the province-wide lockdown begins before we reduce our social interactions. We must avoid social gatherings under all circumstances, including holiday celebrations, workplace end-of-year celebrations, play dates, birthday parties, dinner parties, etc., even with close family, friends, or people that you trust. I would like to show an additional slide here. Just move this. So what this graph shows, this is from the provincial modeling yesterday as well, is that when you enter lockdown, you still expect to see an increase initially of cases, and the effect of lockdowns will vary with the starting case numbers and the length of lockdown. So what this means is that if we continue socializing at the same rate as we have to date, our situation will become worse before we enter the province-wide lockdown, in which case it will become more difficult for us to bring our case rates down. And 4 weeks may not be enough to slow the spread of COVID enough to exit lockdown. That is, if we do not start reducing our social interactions now. And if we socialize and gather even more before lockdown, thinking that it's okay for a last hooray because we're going into lockdown, we will make it even worse for ourselves. We will pay for it even more later. Finally, I'd like to show you one last graph. According to the latest provincial modeling released yesterday, in any scenario, even with no growth, Ontario's ICU capacity is expected to be exceeded by the end of this month. Sorry, I'm just going to move this. So this is the graph. It's provincial. You see the ICU, sorry, the hospitalizations rather here, and then the ICU admissions here. But it's the same situation for our local hospitals who are under very significant strain. This is a very serious situation. Our local healthcare system is already at the tipping point. COVID-19 is widespread in Waterloo region, and the speed at which it is spreading is increasing again. Therefore, we cannot wait another day to, 1, no longer socially gather with others, 2, only go out for essential purposes. In closing, thank you to the many of you who are doing all that you can to keep our social interactions to a minimum. We need to all pull together and do everything we can to slow the spread. Thank you.
Thank you, Dr. Wang. We'll now hear a vaccine update from Deputy Hilton. Welcome.
Good morning. Thank you, Chair Redman. Yesterday marked a milestone in Waterloo region. Our first shipment of the Pfizer COVID-19 vaccine arrived at Grim River Hospital. We received enough to vaccinate 2,400 people. The vaccine will be used for the first time in a scheduled vaccination clinic at the hospital. This will occur later this afternoon with staff from Chartwell, Elmira long-term care residents. Due to limited vaccine availability in the initial phase of the program, the Government of Ontario has identified clear priority populations for vaccination, including staff in long-term care homes and hospitals. The Vaccination Distribution Task Force continues to meet daily to discuss logistics and is continuing to take its lead from the provincial task force. We are working closely with long-term care homes to schedule vaccination clinics. Regular clinics will then run throughout December and into January, and those receiving the vaccine will be by appointment only. Again, we ask that members of the public not call local pharmacies or their doctors to book an appointment for the vaccine. Vaccines will only be administered at one verified clinic, and at this point are by appointment only. The vaccine is not anticipated to be available to members of the general public until later in 2021. Although a vaccine is an important step towards recovery, safe distribution to the general public will take time. Along with your patients, we ask that the community continue to follow the public health guidance. In closing, I would also like to note that due to safety and health concerns surrounding COVID-19, media will not be permitted at the vaccination clinic today. However, photos and video of the first vaccine being administered will be provided to them later this afternoon. Thank you.
Thank you, Deputy Hilton. Now I'd like to introduce Ron Gagnon. Ron is president of Grand River Hospital, which was chosen as one of the new COVID-19 vaccine locations and received their first shipment yesterday. Ron, can you please give us an update on what's happening in the hospital over the next few weeks?
Sure, thanks, Chair Redman, and happy to be here today. And at GRH, we're quite proud to be working with such a great group of people as part of the task force to make sure that this important step in our recovery from COVID-19 goes well. So as you just heard, we're going to be starting up our clinics today, and then over the course of the next couple of weeks, we will ramp up to doing 400 vaccinations a day through the clinic. And as you heard, that will be focused on long-term care home staff as the first priority. And then we will continue to follow the priorities established by the province, and then augmented here by our task force as we receive more and more vaccines over time. And I would anticipate that we will continue to learn from this clinic and use that learning as we start to spread vaccines throughout the community in the months to follow. So again, I would want to reiterate as well, this is an exciting point in the journey, and it is really important that we continue to follow the advice that we just heard from Dr. Wang, and continuing to mask whenever we're in public, minimizing the amount of time we leave our homes, making sure that we're washing our hands frequently and always maintaining that physical distance. And it's been a long road and it's been a long journey, but I would encourage everyone that the light is there at the end of this tunnel, and by pulling together, we can have the success we had early on, and we can see a much brighter future in the not too distant future. So thank you for that.
Thank you so much, Ron. And I would just point out that we are joined by CAO of Waterloo Region, Bruce Lauckner, if the media have any questions specifically for him. Lauren, do you have a question?
Yeah, so I was wondering, with the lockdown coming on Boxing Day, that kind of gives the opportunity for people to gather on the 24th and 25th. And I'm wondering, Dr. Wang, if you have any advice or if that was the right call to do the lockdown on the 26th as opposed to earlier.
Regardless of when the province will go into lockdown, province-wide, this is in our hands. We can make that choice. And that is why I'm urging Waterloo Region residents to no longer socially gather with others and only leave their homes for essential purposes starting today, and not wait until we officially go into province-wide lockdown.
Lauren, do you have a supplemental?
Yes, and you mentioned earlier as well that it may take longer than 4 weeks for the lockdown. Do you have any expected timeline, or what you think is likely based on our data?
Yeah, right now it's not going in a good direction because we're continuing to climb in terms of our average number of new cases per day. So that's why I'm really appealing to our residents to start now. Many of them have already. We just need all of us to do that. We really need to bring our social interactions down, because that is the way to enable the province-wide lockdown that will start as of this coming weekend, to really have the best chances of lowering our rates locally, so that when we exit the lockdown, we can really exit the lockdown. If we think that it's okay to continue to socialize and maybe even up our socialization because we won't have a chance to later, we're actually going to make things much worse for us and put us in a position in Waterloo region where we may not be able to exit lockdown measures. Because if we continue to climb, and we generally see that initially after lockdown measures are put in place, you can't stop that moving train quickly right away. So if we're on an escalating trend and we continue that into the beginning of the lockdown, it will just make it harder for us to slow down the spread, turn it around. And in that case, 4 weeks may not be enough. And so that's why I'm really trying to make that clear with our residents, that it's in our hands. We can do this. We can really all pull together and minimize our social interactions as much as possible, starting now, for us to have the best chances of exiting lockdown when it's projected that the lockdown measures would be over. So that's my overall message. Yeah.
And Lauren, sort of the nub of your question was that there seems to be a bit of ambiguity in having it start on Boxing Day, but I would have to tell you that the lockdown will bring clarity, which the public have wanted. They don't like ambiguity. What has been consistent and clear and will continue until we have a vaccine open to the general public will be those public health guidelines that Dr. Wang has repeated and repeated. And even after we start rolling out the vaccine, people need to wear masks. They need to stay home if they have symptoms. They need to get tested and stay home if they're feeling ill, and stay in their household. So those messages have been consistent right the way through. Nicole, do you have a question?
Yeah, I've got a question. Now, over the weekend, Dr. Wang, you were part of a letter with other medical officers of health requesting residents not hold any social gatherings inside and out. Yesterday, when the province announced its shutdown measures, it was allowing for a maximum of 10 people outside. Do you agree that the province isn't going far enough, and would you be willing to order a Section 22 to potentially fine people for gathering outdoors once the lockdown happens on Saturday?
Well, thanks for the question, Nicole, because it has been a question, and one that is potentially an issue that's potentially confusing. There have always been medical officer of health recommendations, and then there have been on the other side, or complementary, I should say, regulations, right? Requirements as set by the province. So medical officers of health that signed that letter that went out really want people, really want to pass a simple message: do not gather. Because we know that there are different regulations. And we've seen this under the different colors of the framework, right? If you're under this color, it's 10, and then that color, it's 25. And then not only, those numbers, but depending on the setting, it could be different, 50, in another setting, it's 10. It's very confusing potentially for people, which is why, yes, correct, by law, it's 10 maximum outdoors. But what we're saying as medical officers of health is, don't gather at all. It's just a simple message. And we hope that making it simpler like that will help people remember. Because there's been confusion, and sometimes people think, well, it's okay here, then it should be okay here. And then they have all these numbers, people have different numbers. No, really what we're wanting people to remember and abide by is Do not hold social gatherings. Anything that's non-essential, any kind of gathering that's non-essential, just don't do it, whether it's indoors or outdoors. This is the best way. If we all pull together and we all do this, this is the best way that we can get our case rates down.
Nicole, do you have a supplemental?
I do. I guess this would be for either Bruce Lauckner or you, Chair Redman, or for you, Dr. Wang. Would you recommend people call enforcements on their family, friends, or neighbors who are going against social gathering limits in order to prevent further spread this holiday season?
It sounds like a Mr. Lauckner question to me.
Yeah, thanks, Nicole. You know, I'd like to think that most people will listen to Dr. Wang and listen to provincial officials and think about their neighbors and think about the message that Dr. Wang just delivered, that it's going to take everyone in the community to heed these guidelines. And if we don't do that, then businesses are going to suffer, children are going to suffer, everyone's going to suffer, because we're going to be in lockdown a lot longer than 28 days.
And I guess, Nicole, I would just channel Ron Gagnon's colleague, Lee Faircloth, when she talked about finishing working all weekend and coming home exhausted and absolutely, played out to separate from her family and her home and seeing a big party up the street, and what that does to the morale and the gratitude that we were all showing in the spring to all of our frontline workers. So if you're not going to do it for the community, you should do it for all the people that are putting themselves in harm's way in order to make this community safe. In many ways, it's the least we can do. Dr. Wang, do you want to add anything?
No, I think that was really well said, Chair Redmond and Bruce. Thank you.
Okay. Damon, do you have a question?
Yep. So I'm wondering kind of just the process of choosing which long-term care facilities would go in which order and why Elmira or Chartwell Elmira was chosen for first.
Okay, so I can take a crack at that. We prioritized homes based on their level of potential risk. We do know with the experience that we've had not only in Ontario, but in other jurisdictions, that when you have long-term care homes that have a physical layout and a density such that it's hard to separate residents and keep them, separated in groups as needed. When you're going into an outbreak, you have to do that kind of separation. We call that cohorting, as well as separating residents from each other individually. When you have homes that have a density and a layout such that it's hard to do that, you really increase the risk that it spreads quickly across the facility. So older homes that have 3 to 4 people per room, the older ward rooms, are examples of facilities where there's a higher risk of spread should COVID get into the facility. So those kinds of homes have been prioritized higher on the list. Also, the size of a facility can increase their risk because if there's more people in the facility, it can spread to more residents and staff. So that's another criteria. And then thirdly, if a home is in outbreak, temporarily it wouldn't be eligible to receive immunization. But once it's out of outbreak, it will go back into the priority list where it normally should have been. So those really, those were the key criteria that were used to prioritize the homes. All homes will eventually receive the vaccine. We just wanted to proceed with those that had the highest potential of risk first. Thank you.
Damon, do you have a supplemental?
Yep. And I'm just wondering, is it mandatory for the staff at these facilities to receive the vaccination?
No, it's not mandatory like other vaccines, but we highly encourage everyone that's offered the vaccine to receive it. It's safe, it's effective.
Okay. Joanna, do you have a question?
Yeah, we touched on this a bit, but just getting back to social gatherings, you know, this has been a message for quite some time now. Do you think with the shutdown that people will actually follow these recommendations?
Yeah, it, you know, it's my hope that with the provincial shutdown and with our local situation, people really understand that this is really serious. And, you know, we really have a lot of control over this. And, but if a lot of us don't do it, then, you know, we're just going to be in a much worse state. So I'm hopeful. I'm hopeful that with the provincial lockdown, people will understand now that this is very serious and that we can't wait to act any longer.
And Joanna, just to add to that, I think that there's a perception in the community that when we talk about public health guidelines and we talk about provincial directives, that they're sort of suggestions. They're not. This is actually a legal requirement. And it's one of the reasons why I wanted to debunk some of the social media comments that said that we don't have any intention of pressing forward with the fines and the charges that have been laid to establishments when enforcement has gone in after education and actually levied fines. We have every intention of following through with these. They're very serious. And it's one of the reasons why in my comments, I said, we will continue to use education and enforcement by our bylaw officers, our public health inspectors and Waterloo Regional Police for as long as it takes until we're out the other end of needing to have restrictions on the community because of the pandemic. Joanna, do you have a supplemental?
Yeah, just regarding the first vaccinations, just wondering maybe Chair Redman or Dr. Wang, if you just wanted to share your thoughts on sort of this sort of historic day in the region.
Dr. Wang, do you want to go first?
Sure. I'll keep it short. You know, I'm really grateful and I'm very happy that we'll be able to administer vaccines soon because it's really the light at the end of the tunnel for us. And what I really want people to understand is we just have to hold on until we can get enough vaccine, you know, distributed to our community so that we can start to lift the restrictions and the requirements. We have to hold on. It will take some time. It's a matter of months and not a matter of weeks. So we have to hold on for that much longer. But it's all going to be worth it if we do. And this is actually, I know this is a word that's been overused, but this is actually unprecedented that, you know, we're in a position so soon to be able to offer this vaccine. So it does really give a lot of hope, and I'm so pleased about that.
And Joanna, I would say that I am thrilled with this news, and I am so proud of Deputy Hilton and all of her team, and Ron Gagnon and his amazing staff at Grand River Hospital and our public health sector. We often talk about collaboration and cooperation, and I think that is the hallmark of Waterloo Region. And I think all of those people pulling together, the provincial government and the federal government leading into this and making sure that on the world stage that we got the vaccines that we need, really does go back to the tagline I said before, that we're in this together, but we will get through this, but it will be together. And often it's said that we're all in the same storm, but in different boats. And I think that we've got an incredible life raft with the vaccine, and we've got the right crew that are going to steer us through this. And just to underscore Dr. Wang's point, it's very encouraging. It's a time of year when days are shorter, it's colder, we're asking people to stay in their household. This is a glimmer of hope, but we still have a long way to go, and we still need people to follow those public health guidelines. Ron, were you putting your hand up that you wanted to join in, or were you just gesturing?
I was just agreeing with what you were saying.
Okay, thank you. Kate, do you have a question?
Yeah, my first question is for you, Dr. Wang. During your opening statement, I felt like you were on the cusp of saying, I'm going to put us into lockdown a little bit earlier. And I'm wondering why not say, you know what, noon on December 24th, we're in lockdown because people are saying that they're going to gather anyway. Here, I know in the past you've said we don't want to go into lockdown too early because then businesses can't access the funding and the region can't access the funding from the province. But in this case, you know, it would be a day and a half early. It could make a big difference for people and it wouldn't really impact the economy. So just wondering on that.
Yeah, no, thanks for the question, Kate. I think, you know, what I'm urging people to do is what we as individuals can control, and we have the biggest role to play in whether this lockdown, even though, you know, it's going to go into effect a little later, whether this lockdown is really able to be effective. That's why really I'm urging people to act on their own to reduce their social interactions, because that's going to ultimately be the biggest factor in terms of whether we can reduce our spread of COVID in the community. You know, the lockdowns are a forced measure to force society to slow down the interactions. They come at great economic cost and other costs. The government has made a decision taking into account multiple factors that, you know, they have to take into account in order to make a province-wide decision. So I respect what they have done and decided, but I know that regardless of that, we in Waterloo Region can make a real difference in our area through our own individual actions. So that is why I'm focusing on asking our residents to minimize social gatherings starting now, because that will actually be the most important determinant to all of this working. And to do that even before we are, quote unquote, forced to through a provincial-wide lockdown.
Kate, do you have a supplemental?
Yeah, and this actually might be more for you, Chair Redman, or maybe Bruce. I mean, Dr. Wang talks about people acting on their own, but, you know, she's been asking that since March. And, you know, the summer wasn't so bad, but things this fall have certainly gotten worse. And we've seen that in the rising case numbers. So I'm wondering at what point the region or bylaw or public health inspectors say enough with the education. You know, people need to understand the repercussions of their actions. So now we're going to start finding people more so than we have been.
Mr. Lauckner?
Yeah, so, you know, I think we're at that point, and we were at that point a while ago when we said, you know, education has gone on long enough, and where necessary, police and bylaw will issue fines. You know, we're well into that point right now, and I know that police and bylaw will not hesitate to fine when they find people in contravention. And again, I say, you know, it's unfortunate. We are trying to compel people to do the right thing. I know some people don't want to accept the issues or challenges related to COVID, then, you know, maybe other angles. I know Ron's Hospital and Cambridge Memorial and St. Mary's are canceling procedures right now. You know, procedures for loved ones, procedures for friends that will be delayed, and that has an impact. And we've seen that. Maybe not immediate, but certainly not too far away. That has a health impact on people, and hopefully community will start to police itself, and neighbors and friends and so on. And as Dr. Wang has said, we can get through this but how long it takes and how long the lockdown is going to be dependent on the actions of 630,000 people.
Dr. Wang, did you want to add something?
No, he already said it. Thank you.
The only other point that I would make is I do believe, Kate, we are at that point, and everybody's very serious about making sure people comply. I think there was a little bit more education provided when we went from one color of the framework to the other, just to allow businesses to keep up with the changes. I think it's pretty clear right now where we are, and I think this shutdown has brought certainty and clarity for at least 28 days. I see Ben went off. Ben, do you want to come back on? Do you have a question?
Yeah, just a clarifying question to start off. Is there an enforcement update this week or no?
Not an official one, no.
Okay.
We don't have a week's numbers yet.
Okay, makes sense. Dr. Wang, I'd like to kind of address a story that we were seeing in the news the past couple of days about this new strain of COVID in the UK that is making some people pretty nervous. How would we end up actually testing for the presence of that strain in Ontario or Waterloo region? How would we even know that it was here?
Yeah, that kind of analysis would be done either at the federal or a provincial level, where they have specialized lab expertise to be able to do that. So I understand that it hasn't been detected in Canada yet, but that the federal and provincial governments are monitoring for that very closely.
Okay, and I just wonder if you'd want to take this opportunity to address what you said at the end of your letter yesterday about mental health supports.
Mm-hmm.
Great.
Yes, I mean, unfortunately, I don't have the numbers or the web site link that I did last time, but I think we have that on our regional website. Really, I just want people to know that, our mental health is really important, and we should never feel ashamed to reach out for help. In fact, it's not a sign of weakness when we reach out when we need to. It's a sign of strength. And there are mental health supports out there for our residents. We know that the holiday season, while it's festive for many people, it can be very depressing and difficult for other people. That's the case every season. And so, with a lockdown, that's going to be quite difficult for many of us in Waterloo region. So I just really want people to know that there are mental health supports out there in our region. They are available to help, and to please do not hesitate to reach out because, it's actually very important that people don't feel any kind of shame for reaching out when they feel the need to. We all will have that need at some point in our lives, and we should just we should know that there are others out there that care about us, and feel free to reach out. I don't know if anyone else would like to say anything about that.
Ron, Deputy Hilton? I think you said it really well. It's just
Okay.
we recognize that this can be a very sad time of year for people, and during a pandemic, probably additionally so. Are there any further questions? Anyone have another question? Okay, we'll go back to Lauren.
Thank you. Yeah, this is a bit more of a cheery one, I guess, but with the vaccine now becoming available, I'm wondering if there's anything that you're looking forward to for 2021, and that could go to anyone who'd like to answer.
Ron, why don't you go first?
Sure, I'll take a shot at it. So what I would look forward to in 2021 is the day when we get back to, I guess what we will all call quote unquote normal, but where, we're not asking our staff and physicians to go above and beyond, which they've been doing for the last 10 months now, where people are able to get their surgeries when they're scheduled, when we're not delaying care, when we're able to celebrate together in a way that we're familiar with, and when the people that we love and care for, that we choose to find a different way to celebrate with this year virtually, we're able to celebrate with them next year in the same place. Because we love them and care for them, that's why we want to spend time with them. And by doing that in a different way this year, we'll be able to do that next year. And that's what I look forward to, is to see my father next year. And I haven't seen him in 10 months. So that's what I look forward to.
That's a great answer. Deputy Hilton, what are you looking forward to?
Thank you. What I'm looking forward to in 2021 is looking back at this moment in time as history, and that our present is much to do with family, gathering, healthy community, where the pandemic isn't something that we speak about on the daily. It is something that we remember journeying through together and making it through to, like I said, a healthy community where the vaccine is now available for everyone, and that we can continue on the quote unquote normal path of, and again, I always go back to family and friends. Thank you for giving me the opportunity to answer that.
Dr. Wang?
Oh, too many thoughts running through my head right now. I was wondering if someone else wouldn't mind going ahead of me.
Bruce?
Sure. Similar to the others, looking forward to the day when people like Dr. Wang and all the essential workers, frontline staff, first responders actually get a real day off instead of this maybe part of a day off. Looking forward to hugging my nieces and nephews. Looking forward to going to see my dad without the mask on and all the PPE, and being able to get back to some normalcy. So really looking forward to, as Ron said, spending time with those I love that I haven't been able to see in a long time.
Dr. Wang, do you want a shot, or are you just as happy?
Sure. I'm really looking forward to a time when I don't have to ask people to stay apart from the people that they love and care about, and that I can bring some brighter news to residents of Waterloo Region. And I know that time will come. So I'm looking forward to that.
And I guess I'm looking forward, very much like everybody else, to looking at the lessons learned through this pandemic when we've got the vaccine and everybody who wants it can get it. And that we lean into those learnings, because there's been some fabulous learnings and some agility and pivoting done by local government, by federal, provincial government, as well as the business sector. And I'd like to see those kinds of things continue. And I want to hug my grandkids. Kate, you had another question?
I feel bad doing this after that warm and fuzzy question.
Lauren, we should have kept it till the end.
I did want to ask Ron, though. We had Lee Fairclough on the show today talking about what things look like at Grand River, or at St. Mary's General, and I'm wondering if Ron could give us the state of Grand River these days, how staff are feeling, what he's hearing from people. You know, it's been almost 10 months of wearing extra PPE. And in terms of ICU, what things are looking like, whether or not you're hitting capacity, and if you're canceling surgeries.
Ron?
Mm-hmm. Well, thanks for the question. Yeah, thanks for the question. I'll start with our people. You know, they're tired. They've been at this for a long time, and we knew at the beginning it would be a marathon. Still, they are tired, and they see the impact of this virus in people every single day, and that wears on them, I think, even more than the hours they put in, and those hours are extremely long. So they are tired, and with the vaccine coming, they are hopeful, and they are also hopeful that the messages of Dr. Wang and others are heeded. And I would say that they would ask our community to heed those messages. So that's how they're feeling. as far as our ICU, I can tell you the hospital overall, we have 19 people with COVID-19 in our hospital today. Our ICU has been teetering on maximum capacity to the point where we've actually established plans now of where we would be able to encroach into to add more capacity to provide ventilation for people if needed because of those projections that you saw earlier. We have reduced our surgeries as well to be able to create space and to deal with some of the outbreaks that we've been dealing with internally. So there's lots of moving pieces. We continue to provide safe care. So if people need care, they should absolutely come to our emergency room and they will get exceptional care there. And, again, just to underscore the message of by us all doing our part, we can actually help to minimize or at least turn down that curve of demand on each of those hospitals.
Nicole, go ahead.
I guess this is a follow to Kate's question and a request she made similar to last week in regards to getting images and photos of, the first vaccine. This time around, we do have stock footage from Toronto, from their hospitals about what is happening in their hospitals. I'm just wondering if there's been any consideration about getting the same sort of footage for our local hospitals so people here can actually get a fair picture of what is happening locally, because you can say everything, words matter, but visual always trumps over words. So I'm just wondering if that request can be made.
It can be, and I don't know, Deputy Hilton has disappeared off my little Hollywood square matrix here.
More of the hospital settings, like the ICU, not necessarily the vaccines, but the ICU and all that other stuff. Like those images, I think locally would help us paint a better picture and show our readers, our viewers, what is actually happening here in our local hospitals.
Okay, I think, Ron, do you want to respond or we'll just take that under advisement?
Yeah, I'll respond. I guess I'm going to respond with a question. So, Kate, have you had that not Kate, Nicole, have you had that conversation with our communications folks?
Yeah,
to make that
we
ask?
have. We've made that ask, however, for me personally to go in and film myself, but we understand now, with outbreaks and whatnot, we obviously understand the precautions, but we wouldn't like any footage, I guess the media could get from the area hospitals, not just Grand River, but all the hospitals would really help us out.
Mm-hmm. So what I'll commit to is I'll ask our communications team to work with the two others to see if they can provide the media with that stock footage. As opposed to people coming in, we would push it out.
Okay, thank you. It sounds like Kate and Nicole are on the same page. Joanna, did you have another question?
Yeah, I guess just a final pitch you guys want to make for people who are thinking about Christmas and still maybe are planning to gather with an extended family. Don't
gather with extended family would be my response. Absolutely in the spirit of the season, it should be not what we receive, but what we give. And this is something that's in all of our control to do, Joanna. And that's to act on the advice of public health and the directives from the province and stay home and celebrate virtually. I know my family is planning a virtual call and playing a game. I imagine a whole bunch of other families are too, so it might lead to breakdown of Wi-Fi connection, but that's our intention, is to play a game online and be together at least virtually. There are so many other ways that we can reach out. We can phone people. In this day and age, the greatest gift people can give each other in this holiday season is to think of others and stay in their household, unless they live on their own, and then they can be part of somebody else's family household. Dr. Wang, do you have anything else? You're on mute, Dr. Wang.
I'm sorry. No, I don't have anything to add. I think that was very eloquent. I don't know if anyone else has anything to add. I think I've maybe been a bit of a broken record, so I'll let others maybe say things if they'd like.
Okay. Damon, did you have another question? Ben, I know we let you slip in one for clarity. Do you have another question?
Not that I can think of right now, no.
Okay. Well, I want to thank all of you for joining us. Our next community update will be December the 29th at 11:30. That's between Christmas and New Year's for those who celebrate. So I want to wish everyone a joyful Christmas while staying home for the holidays. And to help kick off the holiday spirit and our stay-at-home message, we're leaving you with an inspiring performance by our local KW Glee Club performers. I hope you enjoy it. I hope you all stay well and find the joy of the season, however you do that.
Thanks very much.
Snow is falling down, yeah, it's been a really crazy year. But Santa's coming round, so we gotta spread a lot of cheer.
Ooh, we got nowhere to go, let's snuggle up and stay inside. Sleigh bells ring, are you listening? This is what I got in mind. We don't need gifts and things, just jingle bells and we three kings. So hark the herald angels sing. Hit the lights, make our spirits bright. Dance the night away to our favorite songs. All is right on this silent night. We're together now, here where we belong. Stay home for the holidays. 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 Forget the busy streets, cause family is all we need. Let's get out the fleece, yeah, deck the halls and trim the tree. Ooh, let's make the place look great, really decorate it to the nines. Sleigh bells ring, are you listening? This is what I got in mind. We don't need gifts and things, just jingle bells and we three kings. So hark the herald angels sing. Hit the lights, make our spirits bright. Dance the night away to our favorite songs. All is right on this silent night. We're together now, here where we belong. Stay home for the holidays. 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 I know it's hard to be away from the ones you love this time of year. In my heart there is a way to spread peace and joy for all to hear. Hit the lights, make our spirits bright. Dance the night away to our favorite songs. All is right on this silent night. We're together now, here where we belong. Stay home for the holidays. Stay home for the holidays. Stay home for the holidays. Stay home for the holidays.
That was great.
Yeah, stay well, everybody.
You too. Bye-bye.